HIMSS Europe 20. Without further ado, please welcome our moderator, Dr. Charles Alessi, Chief Clinical Officer of HIMSS. Over to you, Charles.
Thank you, Lisa.
Welcome to this HIMSS and Health 2.0 digital event. My name is Charles Alessi and I'm the Chief Clinical Officer for HIMSS. And I'm delighted to have two people to have a conversation with today, Tim Kelsey and Anne Snowden, both of whom are really old friends. So I'm going to ask them to introduce themselves. Let's start with you, Anne.
Thank you so much, Charles. I'm a professor of strategy and entrepreneurship at the Odette School of Business in Canada. I'm a nurse by training, and I'm also the director of research for HIMSS Analytics.
And thanks, Charles. Yeah, my name is Tim Kelsey. I'm the Senior Vice President for Analytics internationally. I was before that Chief Executive of the Health Agency, and before that I was the National Director for Patients and Information in NHS England.
Thank you. So we don't have much time, so let's use it because we have a really exciting subject to talk about today, and it's the digital health indicators. Anne, would you like to introduce this to us?
Absolutely. If I can go to the first slide, please. The digital health ecosystem is really the framework underneath why we developed the digital HIMSS health indicator, which I'll describe today. If you go to the next slide, please. There were early on some very important signals that healthcare systems globally have not been achieving all of the outcomes of their mandate, really, which is to keep citizens healthy and well. Medical error is just one of those examples. It is the cause of death in North America. Very similar data across other global systems would suggest how is it that health systems have and cause harm at a rate of third leading cause of death. So that's one signal that health systems really needed to think about a transformative agenda. Next slide, please. The second is what we often refer to as personalized medicine, or in some cases, what we could say in precision medicine. This is a graphic that was published just a year or two ago, and it really demonstrates the 10 most commonly prescribed drugs in the US population. These drugs are relatively similar in other jurisdictions, often under different names. But in this graphic, you'll notice red people and blue people. The red people for each of these drugs is the relative number of people when prescribed that drug actually achieve value. The blue people is the relative number who actually either achieve no value for that drug or actually may experience harm. But here's the catch. There are few, if any, global health systems that have the digital infrastructure that can distinguish exactly who are the red people that we are delivering care for, who should be receiving these drugs because they do achieve value. And just as importantly, if not more so, who are those blue people who get no harm but probably spend significant money in terms of those prescribed drugs and or may experience harm, which costs significant challenges or errors, as we've seen a moment ago, as a result of taking drugs. So that's a second very significant issue that has been building over a number of years in global health systems. The third is on the next slide, is the whole issue of the empowered consumer. Consumers today in virtually every country and jurisdiction in the world live by and large in digital societies. We go to school online, we bank online, we book our travel online, but healthcare and healthcare delivery models have not been as digitally enabled as virtually every other business sector. Next slide. And then along comes what we are all now experiencing today is the COVID-19 pandemic. As one physician leader shared with me recently, he said, Anne, we are flying blind. Same idea, you get the pattern across these challenges. We are seeing massive surge in demand for care. We have relatively limited capacity to scale quickly, and we saw that in both Italy and New York City, among others. We have at least 90,000 health workers infected by COVID-19. We actually don't know who got infected, how and why, and those who didn't. We have product shortages, PPE being just one of them, and a sudden and rapid shift to virtual care because there's no other way to offer care to patients in the very challenging time of a pandemic. So when you think about all of those key indicators, health system transformation to a much more digitally enabled system, all is becoming very, very important. If you go to the next slide, I'll talk about what that actually means. So no question, digital health is viewed as an opportunity to optimize health system performance and achieve financial sustainability. If we could track and trace every individual patient and know who achieves value from those therapies, think of those drugs we just mentioned prescribed in the US, or which particular medical devices work well, we could actually not only achieve quality safety, we'd also achieve financial cost savings. However, when we talk about digital health, there's relatively little evidence in the literature in terms of what does it actually mean? What do we mean by digital health? What's a standard definition? There isn't one. What's a roadmap to actually get to a more digitally enabled health system? There wasn't one when we started this digital health indicator design and development. So if you go to the next slide, I'll touch on a few dimensions of the building blocks of a digital health ecosystem. These are all identified in various publications in the research literature, and of course the great literature, white papers, and so on. At the basis of this system must be strong governance and a workforce enabled to deliver digitally enabled care and work in environments where data is mobilized so they know what a patient's received in terms of care, has it worked or hasn't it, and how best can we make sure every patient gets access to best care possible. That's about data stewardship, making sure privacy and security is maintained, and supporting the workforce integrity, which is foundational to that system. Democratization of data. It's all about the exchange and movement and flow of data from clinician teams to patients so that as a patient, you know exactly how you are progressing towards your health goals and you're easily enabled to connect to your care teams and help them when and where and if you start to not make the anticipate making. All that democratization of data is have the analytics to make sense of it and identify outcomes, not only at an individual level, but at a population level. And you have the data infrastructure for traceability. That's when you actually move towards a digitally enabled ecosystem where patients, citizens, consumers, however you describe them, are meaningfully connected to their provider teams when and where it's needed, so people are able to help themselves, help them manage their health and wellness, stay healthy and well, and that drives population health and wellness overall. Next slide. How do you measure it? If you can't measure your digital capacity, then how could it possibly be a health system can transform their digital health ecosystem environment? That's the basis for developing the digital health indicator. It is simply a measure of the ability of a health system to have the capacity to deliver digitally enabled care. That does not mean that every care provided procedure or engagement or visit is digitally required online. It means that digital environments, digital infrastructure mobilize that data, analyze that data right at the point of care for both patients and their clinician teams. And that informs decisions on how do I stay healthy and well in a secure and private environment? How do I connect to my clinician teams? And what outcomes am I achieving? What outcomes is the health system achieving in terms of their performance, quality, safety, cost, and even sustainability? So the health indicator tool is a one-time measurement of a capacity of a health system to drive towards that digital health ecosystem. Next slide. What are the kinds of things that DHI actually measures? Well, it's organized into 4 dimensions. Interoperability, we just talked about that mobilization of data, the democratization, so that all of the key stakeholders actually have access to the data they need to make decisions and inform decisions. So whether it's clinicians' use of secure tools, or it's the security alerts that are helping us avoid risk and stay healthy and well by getting cued right at the point of care, or just the adoption of digital tools, those are the kinds of things that DHI would measure. Person-enabled health, that's the degree to which a person is able to and has the tools and the support and connectivity with provider teams to manage their health and wellness. How effectively is the system able to generate proactive alerts to reduce risk when someone's health is starting to not progress or not be maintained, and they are threatened by things like what we're seeing today, the COVID-19 pandemic, or any other chronic illness outcome. Population health is also critically important. It's not just about tailored, personalized care pathways for every individual. It's segmenting populations, able to identify which of our population groups is doing exceptionally well, what are the conditions under which those great outcomes have been achieved, and how does that teach or help a system learn how to achieve those best outcomes for all of their population segments of health or their unique populations in a particular jurisdiction. Analytics, of course, mobilizes data, identifies outcomes and progress towards health goals, and of course, governance and workforce or organizational policies. The degree of transparency across a health system, how are incentives and funding models contributing to that digital health ecosystem progress, and what are the accountability tools that help and support workforce capacity and competencies to deliver digitally enabled care. Next slide. The digital health indicator, of course, builds on the maturity tools with HIMSS. HIMSS has 7 maturity tools, and each one of them comes together in very unique combinations to advance each of the 4 dimensions of a digital health indicator. As a health system measured their digital health indicator score, you'd get a detailed review. What are all the 7 maturity tools actually measuring? AMAM is the analytics maturity, which is a very deep dive on advancing not only the mobilization of data, but analyzing that data to create knowledge and evidence right at the point of care in real time. INFRAM is the infrastructure model, which allows for and supports interoperability. Many of you know MRAM, that electronic medical record, and its sister model, the OMRAM for outpatient care. CSOM is the latest maturity tool. That's the clinically integrated outcomes supply model, very much focused on supply chain and how it's automated and digitally enabled across the journey of care. DIAM is the digital imaging model, and continuity of care model is CCMM. Next slide. And Charles, back to you in terms of where and how a digital health ecosystem could advance.
Thank you, Anne. And I was struck when you were talking around your use of some terms, because in many respects, what you're saying is actually quite fundamental. What you're basically saying is the balance between help and harm in healthcare is perhaps not what we hope it is, and the amount of harm is certainly more than we would be comfortable with. So that balance is different, and this is a global issue. I think it goes beyond the United States and Canada. We're seeing it everywhere. The discussions we're having tend to be around the importance of governance, the importance of taxonomy, the importance of workforce, the importance of lack of transparency, and this process together in a really cohesive way. And I'm sure you felt that as you travel around the world, both in Europe, the Middle East, and in Asia.
No question, Charles. And of course, there's pre-pandemic, where the drive towards quality and safety and sustainable cost was very front and center. And medical error, of course, is extremely costly. The challenge being, do we actually measure when and how and where people are at risk for error, so that as a clinician, we could proactively prevent it and intervene? Now we are in the COVID-19 era, and I suspect a post-pandemic era, where it will be all that much more important to be able to track and trace and know who's at risk for recurrence of a COVID-19 infection, for example. Which of our health professionals are at greater risk, and in what settings and what jurisdictions, for becoming infected by pandemic? These are the same concepts. It is tracking and tracing and analyzing data in real time to proactively prevent some of these very, very challenging circumstances.
Thank you, Anne. I'll come back to you after I bring Tim in, because Tim, we heard a description of the digital health indicators, and I mean it is a wonderful description of a system which basically captures all the things which we're all concerned about, which we all know could work better. And really, let's think in terms of its application. In other words, its deployment. So, given you've heard, I mean, why would anybody, how do you talk to governments around adopting something like this? What arguments do you put forward for people to really start taking this more seriously?
Well, thanks, Charles, and thanks, Anne. There are governments and regions, states around the world who are already engaged with the digital health indicator. There have been trials now run in a number of areas: Denmark, Australia, Canada, the US, and other countries are now looking at either national or regional implementations. And the reason that they are doing so, I think does, and we may as well explore this perhaps in the framing that the digital health indicator itself gives, the 4 domains. The first domain, interoperability. Governments around the world have struggled for many years with introducing means by which people can, at the front line of care delivery, are able to share information with common meaning. And probably the biggest cause of medical error and misadventure is the absence of shared information with common meaning. In other words, people either not having access to key clinical information or having access to the wrong clinical information. And although that may seem counterintuitive, that is a very routine occurrence, and very sadly does on occasion lead to great tragedy. We had an incident in Australia, where I'm speaking from today, not that long ago, I'm afraid all too frequently now, where a coroner concluded that a person had died unnecessarily because a piece of medical information was faxed to the wrong number. And so the enemy of clinical safety, and that's been a very big focus for governments around the world, driving them to really want to understand the digital maturity, not just of their hospitals, but of their out of hospital environments as well. So the whole system, and that's what the digital health indicator provides, is a framing for the whole ecosystem of healthcare. And that's, I think, what makes it unique and very valuable. And just to give you some examples there, again, just to cite Australia, each year, roughly speaking, according to the most recent research, about 250,000 people are avoidably admitted into hospital because of medication misadventure. In aged care facilities in Australia, currently nearly everybody, that's 98% of residents, will experience an instance of medication misadventure every year. So every year, something potentially very bad, often of course not actually harmful, but potentially very bad, is happening to individuals across this country. And those figures are replicated across the world. There is a very serious need for improved interoperability as the digital health indicator explores. And in my previous role, I had the great privilege of being the inaugural chair of the Global Digital Health Partnership, which is an international network of now 30 countries in the World Health Organization, exploring precisely these issues. How can the world support countries individually, collectively, to become more interoperable? So that, I think that's the first point I'd raise, just using, as I say, the domains of the digital health indicator to explore the demand from governments and systems. The second domain of the digital health indicator is person-enabled health. And here we've seen over the last few years, with increasing acceleration before COVID, as well as during COVID, moves by governments and by system leaders to provide access to citizens virtually to healthcare. So there have been a number of initiatives designed to help support people, frankly, take more control for themselves when they choose to of their health and well-being. So again, just to give some examples there, in Australia, we launched the My Health Record system back 2 years ago now, so that pretty much every Australian resident, that's about 90% of the resident population, now have access online 24/7 to their key summary health information, as does their treating clinician at the time of care. Now, we know from the evidence that simply people having access to their own clinical information, whether that's medicines or diagnostic information, actually supports them manage their condition more effectively. But it also critically, at points of greatest vulnerability, helps their clinician make the right decisions. So simply knowing what allergies a person has that you may not have seen before, that person's on holiday, that person's in an emergency situation by the roadside, with summary information of this kind can be life-saving and is critically important. So how often do systems provide those kinds of services to clinicians and to their patients? These are the sorts of questions the digital health indicator surfaces for system providers. And a similar service, of course, in the United Kingdom, or in England rather, where the summary care record has been doing its good work for a number of years in the background, providing pharmacists, in-hospital care workers, out-of-hospital care workers with access to that critical summary information. And these are means by which people are empowering citizens, are empowering their care professionals with digital access. And in addition, we've seen, of course, during COVID, as Anne mentioned, an explosion, frankly, an unprecedented shift in adoption of telehealth services by clinical professionals. And that's particularly been true in out-of-hospital care delivery in a number of countries in Asia Pacific and in Europe. We've actually seen physical encounters as the normal mode of clinical interaction reduced by up to 80%. Large to facilitate care delivery where that's appropriate. Now, everybody, of course, is focused today on maintaining that momentum as we either work towards resilience, creating greater resilience for potentially another wave of pandemic, or as we come past pandemic, looking forwards to the future where governments, system leaders and others are now able to absolutely see the way in which telehealth does provide a means of a greater equity of access for health services in general. So person-enabled health, supporting the consumer, supporting their care professional with better access to information that will also support transformation of models of care, another very big driver for governments in consideration of the digital health indicator. The third domain of the indicator is predictive analytics, and perhaps this is the real key, as Anne again was suggesting, the idea that you can run a health service, a safety critical industry, an industry which does have, where quality is measured by the degree to which it avoids accidentally harming people, as you've said, Charles, very important indicator of healthcare, actually not running itself intelligently, not knowing just how well it is performing, not knowing what its outcomes are. These are just not any longer acceptable features of modern health services. Patients, the citizen, and care professionals all now expect, of course, quite rightly, that a health service should be able to report and deduce which outcomes it is producing and to reduce their variation. So predictive analytics is a vital ingredient in being a modern consumer-facing, consumer-centered health service, and particularly one that's concentrated or that's prioritizing quality and safety in care delivery. But of course, it's not just about quality and safety, it's also about waste. And a very big driver, as Anne sort of mentioned, is the fact that every health system in the world is currently facing not just a pandemic, a disease pandemic of COVID-19, but also a series of other tidal waves of demand for services, the advancing, very rapidly advancing demand caused by chronic illness in the general population, rapidly aging societies, as well as very significant fiscal constraint combine to mean that waste is the enemy of sustainable healthcare. And as again, governments and system leaders really very rapidly focus on the need to render a more effective, more efficient, high value health service, predictive analytics becomes absolutely critical. The ability to really track demand for services in real time, to be able to plan packages of care for individuals as well as for communities, so that they are both delivering the highest possible quality for those individuals, but most efficiently, and reducing waste as far as possible, a very important component of a safe, sustainable health service. And just, you know, an additional challenge today for health services around the world as they begin to embrace the opportunity of digital health is the very stark reality that not just the exposed through COVID, but the work, there is an increasing shortage of clinical workforce around the world. And the current predictions are that by 2030, we may well be looking at a shortage of key clinical workers, that's doctors and nurses, physiotherapists and others, of around 10 million across the world, a situation which will make managing a pandemic of the kind we're experiencing today very, very difficult, almost impossible. So working out as well through the very judicious use of analytics where digital services can support human delivery of care work will be a critical factor in shoring up systems in light of that emerging shortage. And then finally, we have governance and workforce. So perhaps that workforce shortage we've touched on, but governance in the digital health indicator terms is also very importantly about accountability. And the accountability I'm talking about is really that between the service and the community that's being served. Now, just for one moment, we step back, but this in many ways may be the most important driver for many countries around the world, and that is the adoption of universal healthcare as a principle of care delivery. So we have countries, I have Australia, of course, the UK, but India, Indonesia, many other countries across the world, most countries in Europe, most countries in the Middle East, committed to providing all citizens and residents with access to healthcare regardless of their ability to pay. It's a very basic kind of part of the social contract between the government and the communities that government is serving. And it's critical for a modern health service to recognize the importance of equity and to be able to report on its success in providing equitable services to that whole community, so that public confidence is maintained in that principle of universal healthcare. And this is becoming a very important driver also for digital health, because without the tools that digital health provides, without data, without some of those virtual care services, without some of the transformations that are necessary in delivery of care, that objective may not be achieved. And in the governance and workforce domain of the digital health indicator, there's a big emphasis on how well a system is reporting on its success in delivering equitable outcomes for the whole community as part of that contract increasingly that countries have around universal healthcare. So look, I'll pause there, Charles. A quick review in a way of what is driving people's interest in the digital health indicator, and also I think what makes up the essential characteristics of its value to those countries and regions.
Thank you, Tim. And you touched on some very important issues, which, I mean, I remember my career as a physician, issues around safety. The number of times I saw a patient who had just been discharged out of a hospital who came for their drugs and was incredibly surprised when I asked what drugs. The number of times when I tried to actually get people much more activated. You mentioned activating patients in terms of giving them the ability to get more involved in their own health and care, and trying to share records with them with very little success in the pre-digital age. You talked about the importance of interoperability. How on earth are we going to deliver care nowadays unless the number of people who are involved in somebody's care, especially when we're dealing with multimorbidity, of course, is able to be connected, because otherwise the potential for harm is enormous. So, I mean, there's all those reasons why this is a good idea, but I think there's one thing which I just want to come back to you on before we then move to have a discussion with Anne as well. And it's really the managing of the non-COVID populations. You know, we are in the age of the pandemics, and this may be a once in a lifetime event, but it's a once in a lifetime event which is going to shape our lifetime, however old or young you are, because the world's going to be very different from now on as to what it was before. And if there's one thing we've learned, it's that we haven't managed the non-COVID populations, the people who happen to be having heart attacks, who are suffering from non-communicable disease, as well as we could have, partly, of course, because we were dealing with them in an analog rather than a digital dimension. And you mentioned the speed, and Anne did as well, at which people are moving in that direction. And of course, this is exacerbated by multimorbidity. So what are the opportunities we have around the Digital Health Index now, where it's very clear we have to deal with that non-COVID population? And there is an urgency to this because we know that we're in an era where it's certainly possible we are going to see further exacerbations of this pandemic or of another pandemic.
I think that's an incredibly important question. Look, the truth of the matter, we could get gloomy about this because the truth of the matter is that we have an acute pandemic currently, and it seems the experts are saying that this acute pandemic may be one of many to come. And as you say, perhaps we are living, or we're seeing the induction of the era of pandemics, acute pandemics. But alongside that, we've got some very, very long-term chronic pandemics, if I can put it like that, which we were trying to deal with. And those include obviously the instance of obesity. Let's give an example. And the facts are that 1 in 3 children pretty much around the world, with some exceptions, are now either obese or overweight, that is under 5-year-olds. We've got in most developed world countries, 1 in 4 people will be over 65 by 2050, and in some cases that is just the tip of the iceberg. In Japan, average life expectancy by 2050 is anticipated to be 90.9 years. That is average life expectancy, which in many ways should be a great human success, but is being regarded as a massive potential social crisis because of the longer lived years of chronic illness and acute illness in that longer life. So these are things which are really extremely significant changes in the way society is looking to, is impacted in its health and well-being, and coinciding with the instance of this unprecedented acute infectious pandemic. And the digital health indicator, I think, does and is being looked at as an instrument alongside the other maturity models, of course, that HIMSS uses to help systems and providers measure their digital capabilities, as a means of essentially putting in place the infrastructure, the basics, to ensure that the very best chance is provided to communities to be able to navigate their way through these very complex ecological, long-term, geological, I meant to say, kind of trends in healthcare. And it would seem to me obvious that, for example, supporting people to manage the health impacts of chronic illness, and certainly the literature supports this, are significantly improved by provision of digital tools, by better analytics, by more coordinated care planning for those individuals. But this is going to be a very complex future process. It is going to require the most adept use of the kinds of digital services that the Digital Health Indicator calls out. But I think it's also going to require a range of other strategies to ensure that societies are able to create those safer, sustainable health services, dealing with these many different burning platforms that are occurring as we speak.
Thank you. Anne, I'm going to, I think that's a very good response, and I'm going to come back to you with this question, Tim, after, because clearly the balance has shifted to harm perhaps being more predominant in some cases, and the advantages are enormous. I understand that, but I'm going to take you to a different place. I am now the chief executive of a large provider of care, and the thought of introducing something which is going to upset people because inevitably change always upsets people because it's different to what they've always done. So really the question is it worth it? Because is it worth introducing these systems? What advantages do they give you if you introduce these systems? What advantages would systems that actually have
seen this in other phases of very significant challenges? We saw it in 9/11, changed the entire travel industry, and they never went back to the pre-9/11 travel. And see their practitioner on that virtual screen, get exactly what they need. Same with their pharmacist, same with all their other care providers. Do you really think they're going to want to go back? So if it were me really talking to that chief executive officer, one thing would be, look at where your citizens are and how quickly they adopted that virtual tool. Countless individuals have said, wow, I'm never going back. I'm not doing the in-person, find a parking place, call and make sure I have an appointment. It's become very convenient. Secondly, is how does digital transformation solve the never again challenge? If we get to that point and find ourselves in another pandemic and continue to have to hunt worldwide for an N95 mask, that would suggest to me that no CEO, no C-suite executive wants to go through that again. Digitally enabled supply outcomes with MRAM, infrastructure interoperability, person enabled, you would know exactly where every patient is in your system, what provider team is on site, what care they've delivered, what outcomes they're achieving, and oh, by the way, how many days of inventory of PPE do we have? I cannot imagine a system that doesn't strive for making sure we don't ever find ourselves.
Part of it, there's a little bit of Groundhog Day in this, let's be honest, and these things come in waves. I mean, you'll remember, Charles, that 20 years ago now, I set up a company called Dr. Foster, which was all about promoting transparency in English healthcare, and we published, data on mortality outcomes for English hospitals, and it was regarded as a very transforming moment, I think, quite a disruptive moment by many of the clinical leaders in the English NHS at the time, and now we're still talking about the importance of transparency, and the honest truth is that that level of transparency isn't the case in most countries in the world currently. So I think we need to be mindful of our history, of our experience, which is these things take a long time to deliver, but equally now with this pandemic of the incredible, the way in which, I suppose, you say, you're right to use the concept of analogy of mirrors, the way in which we are now so aware of the implications of failure to deliver. And I just wanted to reflect that I think if I was speaking to the chief executive, and in fact I do this all the time, so I'm constantly speaking to chief executives about the importance of digital maturity, and whether they're government ministers or system chief executives, this is my kind of, my narrative is that the digital opportunity is not a silo. It's not on its own. It's part of an enabling infrastructure like workforce for improving health services as a whole. And the key drivers for the wish to improve your health service, to continuously improve your health service, obviously related to all the things we've discussed, is because you want it to be as high quality as possible. So there's a very simple clinical driver, which is how can you support clinicians to make the best decisions possible? And that's not about having robots replacing doctors, digital data and digital tools. So that's the clinical imperative. The second imperative is the social imperative. It's recognizing, as Anne says, that in every other part of our lives, we, the consumer, has become a great deal more active. And the net result of which is we have taken on more of the administrative work for our banks and our travel agents and so on. But we are happy because we are much more empowered. We can access those services much more conveniently. And interestingly, those services, the quality of those services has also improved. And the airline, as Anne's the airlines industry is a really good example of that, where in fact costs have significantly reduced, and this is obviously pre-COVID and the lockdown, whilst quality and the number of deaths lost in flight have almost evaporated
Bu
to virtually
vesileyle de
nothing. So a
pandemi
really good
sürecinde
example for
hayatı pahasına
healthcare. So there's that
insanlarımızın
social
sağlığı
imperative,
için gece
recognizing
gündüz
the
çalışan
power
sağlık
of me
ordusuna da
as the
şükranlarımızı
core
sunuyoruz.
focal point for healthcare. Then of
Şimdi
course you've
sizleri
got the
bu
third
süreçte
driver,
hayatlarını kaybeden
Mr. Chief
sağlık
Executive
şehitlerimiz
or Mrs.
ve
Chief Executive, and that
Cumhuriyetimizin
is the
kurulmasında şehit olan
economic
sağlık
imperative,
ordusu,
which is very
Ulu Önder
real,
Mustafa Kemal
particularly in the
Atatürk ve
United
silah
States, where of course
arkadaşları
universal
için
healthcare is
saygı
not
duruşu ve İstiklal
a
Marşı'na davet
political
ediyorum.
commitment. But in the United States, where fee-for-service is the overriding principle of healthcare delivery, obviously there are some exceptions in Medicare and Medicaid to that. We've seen costs inflate to the point where they are going to be absolutely unsustainable in the course of our lifetimes, unless very significant efficiency is found in the way in which healthcare in that country and in many others is administered. But I'd like to dwell just very quickly, finally, on what I think is the most important imperative behind digital health as an enabler of overall improvements and outcomes, and that is the human imperative. And I just reflect on the fact that many people have experienced tragedy during the course of this pandemic. I have one friend whose mother died in an aged care facility. She was taken to an acute, or rather she was taken sick in an aged care facility, taken to hospital. Her daughter wasn't able to see her before she died. She died, and there was no funeral, and that was the end of that lady's life in the most tragic circumstances on every front. And obviously, the grieving process for her family made much. And I reflect on the fact that when of a country or a health service will want to address themselves very urgently to the digital opportunity is because just aged care, just being able to improve the outcomes and safety of our oldest, most vulnerable populations in their in the final years of their lives. And what we've seen around the world is the pandemic exposing our weakness in the treatment and care and safety of elderly people. So I just think that on its own is enough. Just helping people at the end of their lives is enough of a driver for us to be taking digital health very seriously, and to be looking to the digital health indicator to help us understand how we can improve, what roadmap we need to be on to get to the point at which we are genuinely delivering safe care for people in those circumstances.
Thank you, Tim. And really, I could go on for the next hour in terms of having a conversation about this, because it's one of the richest subjects that exists. But it's abundantly clear that in the world today, and even more in the world of the future, it will be very difficult for health and care systems to survive without digital transformation for a whole variety of reasons, a lot of which we talked about today. And it would be very difficult for a system to actually go on that journey of digital transformation without doing it in the best and most optimal way possible for their geography and for their circumstances. And the digital health indicator, I think, the most ideal route to get there. So thank you both and our audience for joining this educational discussion. And if you're interested in learning more about the digital health indicators, please see the link below. Would like also to thank the healthcare professionals for continuing to fight on the front lines. We're already going through an exacerbation of this pandemic. The work that you have done and the bravery that you have shown us all. For your attendance, and I hope you enjoyed this session.
Çok teşekkür ediyoruz herkese katılımları için. HIMSS Eurasia Sağlık Bilişim Teknolojileri Konferansı ve Fuarı'nın ilk günü bu şekilde tamamlanmıştır. Tüm etkinliğe katılan misafirlerimize çok çok teşekkür ediyoruz. Sizleri yarın sabahleyin saat 9'da başlayacak panellerimize de şimdiden davet ediyoruz. HIMSS Eurasia Dijital Kongre ve Fuar Merkezi'ndeki standlarımıza ziyaret ederseniz firmalarımızı gerek WhatsApp chat kısmı üzerinden gerek Google Meet üzerinden toplantınıza katılırsanız, toplantılara katılabilirseniz çok çok memnun oluruz. Herkese iyi akşamlar diliyoruz. Yarın görüşmek üzere.